Hello everyone, this is my leading and managing mental health services assignment. The aim of the presentation is to present the concept and theories of leadership, to identify and explain my leadership and management developmental goals relevant to the 9 dimensions of leadership behaviors, to I will explore and elucidate prioritization and delegation in my mental health practices. I will evaluate progress on my leadership and management developmental goals. What is leadership? Leadership is defined as an influencing process in at goal achievement. So when we are influencing people to achieve our goals, then we are leading. Leadership is one of the primary skills that nurses are needed to develop. This is because effective leadership is recognized as a key to the success of many organizations. It requires commitment and taking responsibility, having empathy, using good communication, and effective management skills. Leadership theories. Research has shown that we have had a lot of theories that have been evolved since 18th century to the present day. The first theory that was developed or evolved in the 18th century was called the great man theory. They believe that leaders are born naturally, not made or trained. And this was also evolved into another leadership theory in the 1930s to 1940s, and that was called the trait theory. They focused on identifying the traits and characteristics of effective leaders. They believed that leaders could be made or could be born, and this also evolved also into another theory in the 1940s to 1950s, and this theory was called the behavioral theory. They believed that, they believed that, or their focus was on the actions and the skills of the leaders. They believe that leaders are largely made. And in the 1960s too, we had another leadership theory that was evolved, and it was called the contingent and the situational leadership theory. They believe that the situation, the environment will determine the characteristics of a leader. So they focus on leaders adapting their style, taking into account the environment. And in the 1990s to 2000s, they have new leadership era that were evolved, and they will include the transactional, transformational leadership, shared, collaborative, inclusive, and complexity leadership theories. The transactional leaders focus on leaders as a cost benefit or exchange, giving rewards to enable people to act or work. So they believe in that. And the transformational leadership focus on motivating people, encouraging and inspiring people, leaders or followers to achieve their aims. So these are some of the leadership theories that have been evolved since 18th centuries to present day life. My leadership style. After reading through or learning through all these leadership theories, I've decided or I've adopted transformational leadership style to be one of my core leadership style that have been used and I will use after school if I become a qualified nurse to lead my people. This is because it will enable me to inspire and motivate my team members in order to create positive changes within an organization. It will enable me to foster a sense of ownership among my team members by sharing ideas, enabling others, transforming behaviors, and arousing commitment of my staff. Factors influencing my leadership developmental goals. There are a lot of factors that have influenced me to come out with my leadership developmental goals, and I've put this into two categories. The first category is called external drivers, and the second category is called the internal drivers. Some of the external drivers include the NHS long-term plan, the vision, the objective of the NHS long-term plan, the vision and objective of the 5-year forward view for mental health service, and the internal drivers it includes the local or organization policies and self-awareness or individual self-awareness, because as a leader or as a person, if you want to become effective, you should know yourself, know your strengths and your weakness, so that wherever that you are weak, able to develop. So these are the factors that have influenced me to come out with my developmental goals. My leadership developmental goals identified. After going through the NHS leadership model self-assessment, I've identified certain areas that are needs to develop, and these are the goals that have been identified. These include engaging the team, leading with care, developing capabilities. There are other things that I need to develop, but I'll talk about only these three goals that I've identified. Critical application of my leadership developmental goals. So the first, engaging the team. In order to engage the team to develop this goal, I need to involve my team members in every decision that I'll make in practice, just to help me to create good atmosphere. And also I need to encourage mutual respect, good communication, and build trust in my team. Also, one thing that I should avoid is by building plans or taking decisions without consulting others or failing to value diversity in my team. It just will not help me to engage the team very well. The next goal is the leading with care. How can I develop or how can I improve in this goal is that I must understand the unique qualities and the needs of my team. I provide caring and safe environment and prioritize the needs and safety of my patient and staff. And I must show genuine kindness, take positive actions, and act with appropriate empathy. And when I'm delegating, I must make sure that I take the full accountability and responsibility and share or delegate the task accordingly. And I must avoid making excuses if I fail in terms of my performances, and make sure I should avoid taking responsibility away from others. The third goal is developing capabilities. In order to achieve this, I have to build capability to enable my team to meet the future challenges, train them regularly, spot out any potential colleague in the team, identify any capability gaps in my team, and I must champion learning, help my team to train regularly, and act as a role model and explore career aspirations. And number one thing that I need to do is to avoid developing only the best people. So in terms of developing career, I must make sure that I should be fair and fair, not concentrating on only those who are the best, but also involve those who are weak as well, so that at least I will embrace diversity in building capabilities. Prioritization is one of the things that's really important to help me achieving all my developmental goals. And when I might prioritize the needs of my services and my team to ensure their safety, highlight immediate risk factors that may contribute to decline in the patient condition. And one of the evident tools that I've learned I want to use regularly is the use of Maslow's hierarchy to decide which needs or problems require immediate action. Delegation. Delegation is one of the skills that will help me to achieve or develop my leadership developmental goals. In delegating the task in my team, I must make sure that the task is delegated according to the ability and experience or the knowledge of my team members. And when I'm delegating, I'll take responsibility and accountability when I delegate tasks in the team, and also I'll delegate the tasks in the best interest of my patient and offer appropriate support and supervision to staff when task is delegated to them, and I will ensure that delegation is done within the competence of my team. Evaluating my leadership developmental progress. Evaluation is really important. Those will help me to assess in the areas that I'm weak, in the areas that I am strong. And I'll do this by using questionnaires or asking for feedback or comments or recommendation from my line managers, supervisors, staff, peers, and progress. And evaluating my leadership progress will be a continual progress from the beginning to the end. I'll conduct thorough analysis of data, combine data over time, and compare the outcomes and trends to relevant benchmarks of my leadership developmental goals in terms of patient satisfaction, safety, health outcomes delivered, and staff satisfaction, engagement, and their improvement. In conclusion, I'll continue to learn to improve my leadership mental goals and inspire vision into my practice to improve patient safety and better health outcomes. And I must align clear objectives for all my teams, develop high levels of staff engagement, support learning and innovation to improve the capability of my team. Thank you very much. This is the end of my presentation. I hope you have enjoyed listening to my leadership development goals. Please do have any questions for me. These are the references and these are the reflective journal on engaging the team, reflective journal on leading with care, and then reflective journal on leading on developing capabilities. And this is the Maslow's hierarchy and the 9 dimension of NHS leadership behaviors and the leadership model self-assessment result. Thank you very much. I hope you've enjoyed listening to me and you have learned a lot. Thank you very much. Have a wonderful day. Bye bye. Thank you so much.